I'm Frank Sell from Genetic Australia, and I have with me Dr. Michael Elstein from, where are you?
From the Eternal Health Medical Centre.
What makes someone healthy?
It's absolutely mandatory that they assess the 4 pillars of health. So, and each pillar depends on the pillar before it. So you can't go to the 4th pillar, you have to start off with pillar number 1. So the very first pillar is digestion. Assessing whether you're digesting what you're eating. Because if you're not digesting whatever you're putting in your mouth, be it food, be it vitamins, minerals, antioxidant supplements, you're not going to get full value.
Right.
And there are ways to actually work out if you are digesting. So I get people to fill out a questionnaire.
Right.
And the questionnaire assesses a whole bunch of systems in the body, one of which is digestion. So I apply the 4 B's to digestion. They're the 4 B's of assessing whether your digestive system is working for you. So there is bad breath. It's very hard to tell people they've got bad breath, but bad breath is the first B.
Yes.
Burping. If you're burping, it means you're not digesting. If you've
really?
got, that's right.
Oh.
If you've got lots of bad wind or lots of flatulence,
Yes.
farting we call it.
Yes.
And then the 4th B is bloating. Lots of people bloat up and when they eat, or not necessarily when they eat, and this is usually connected with a very poor digestive process.
Right.
So we look at the 4 B's to see whether they are happening, and that means any of those B's means you're not digesting real well. The other thing I always do with patients is look at their tongue.
Right.
Very important for health to have a healthy tongue, and a coated tongue is not a healthy tongue, or a tongue is very red around the edges also is an unhealthy tongue. So those who have a coated tongue, a coating can mean either you're not digesting well, you're not producing enough digestive juices, or you're eating foods to which you are intolerant or allergic. And then that needs to be assessed. So everybody needs to be looking at their tongue, not right now, but when this is over, you can look at your tongue in the mirror. And if it's coated, it means you're in trouble and your digestive process is not working for you.
Right. Okay. So that's
pillar number 1. That's the first pillar. Very important.
It's an easy test to make.
It's very important, and most doctors don't do this, sadly. I have patients who go to see their doctors, and the last thing doctors do, they don't look at their tongues or don't ask them about digestion.
Right.
Very important to assess these things. Are you digesting? Because if you're not, the fundamentals of your health are going to be absent, and you're going to be struggling with a whole bunch of health issues.
Yes. How regular should you be going to the toilet?
Probably daily.
Right.
There's a tribe in South Africa called the Bushmen, and they eat a lot of fibre. You see, we don't. Our diets change dramatically.
Right.
We used to eat lots of raw foods, vegetables, and fibre. We eat less of that now.
Yes.
And they go 2 to 3 times a day.
Right.
Doesn't mean we have to go 2 to 3 times a day, but a daily. Some people are annual. Probably the people out there are going once a year.
Yeah.
But at least a daily bowel motion is important.
Right.
Yes.